Hello everyone, good night. Today I'm going to talk to you about the eye and the surrounding structures. The eye is not only the organ responsibility for the vision, it is also part of a very complex anatomical region that includes the bone orbit, structural muscles, eyelids, lacrimal apparatus, nerves, artery, veins, and several clinical important structures. So, the orbit protects the eye's balls and provides attachment points for the muscles that move the eye. It includes formed by several bones, including the frontal, sphenoid, zygomatic, maxillary, ethmoidal, lacrimal, and palatal bones. Clinical, you can see right there. Clinically, the orbit is important because trauma can cause orbital fracture, especially in the orbital floor. This may trap the inferior rectus muscles and provide diplopia, which means double vision. The eyeball itself layers. The layer includes the sclera and cornea. I want to never mind. The eyeball itself has three main layers. The outer layer includes the sclera and cornea. The sclera gives structural support, while the cornea allows light to enter to the eye. The middle vascular layer includes the choroid, ciliary body, and the iris. The iris controls the size of the pupil and therefore the amount of light entering to the eye. The inner layer is the retina, which contains photoreceptors and converts light into nerve synapses or nerve signs. A key structure is the optical nerve cause and is the cranial nerve tube, which carries the visual information from the retina to the brain. Damage to the nerve optic can cause visual loss, and it's clinically relevant in a condition such as glaucoma, optical neuritis, and increase the intraocular pressure. Now, let's talk about the extraocular muscles. There is six muscles that moves the eyeball: the superior rectus, inferior rectus, medial rectus, lateral rectus, superior obliquo, and inferior obliquo. There is also the lever upper prep superois, which elevates the upper eyelid. The rule of innervation is very important because LRSO4 are the rest three. That means the lateral rectus is innervated by the cranial nerve 6, the abducens nerves. The superior oblique is innervated by the cranial nerve 4, the trochlear nerve, and the rest are innervated by cranial nerve 3, the oculomotor nerve. The oculomotor nerve also carries parasympathetic fibers that control the pupil constriction through the sphincter pupil muscles. Therefore, a complete tire nerve palsy may cause ptosis. The eye looking down and out, kinda, and a dilated pupil is compared to use drugs. The abducens nerves control the lateral rectus muscle, which abducts the eye. If the nerve is damaged, the patient cannot move the eye laterally and may develop horizontal diplopia. The trochlear nerves control the superior oblique muscle, which helps to depress and injure the eye, especially when the eye is adducted. Damage to this nerve can cause vertical diplopia, and the patient may tilt their head to compensate, like the. And the sensory innervation of the eye and orbit mainly comes for the trigeminal nerve, especially to the ophthalmic vision, the one brain. This includes branches such as frontal, lacrimal, and nasolacrimal nerves. These are important for the corneal sensation. Loss of the corneal sensation can be dangerous because the patient may not feel injury or infection about the cornea and the facial nerve about this area. Cranial nerve 7 is also important because it innervates the orbicularis oculi muscles which close the eyelid. If the facial nerve is damaged and is a Bell's palsy, the patient may not be able to close the eye completely, increasing the risk of corneal dryness and ulceration. And the blood supply of the orbit mainly comes from the ophthalmic artery, which is a branch to the internal carotid artery. Important branches includes the central retinal artery, lacrimal artery, supraprior orbital artery, and supratrochlear artery. You can see right there. The central retinal artery is clinical essential cause occlusion of this artery can sudden painless vision loss. Venous drainage of occurs mainly throughout the superior and inferior ophthalmic veins. These veins communicate to the cavernous sinus. This is clinically important because infections from the face of the orbit can spread to the cavernous sinus, causing cavernous sinus thrombosis. This condition may affect cranial nerves 3, 4, B1, B2, and 6, producing eye movement problems, facial sensory loss, and several orbital symptoms. And the eyelids protect the eye from trauma, septic life, and dehydration. They contain the tarsal plates, eyelids, sebaceous glands, and the orbicular ocumuscle. Common eyelids conditions include styles of calcification, blepharitis, and ptosis. A style is usually an acute infection of the gland, while a chlysion is more chronic and usually results from obstruction of a meibomian gland. And the lacrimal apparatus produces the drains, tears, and lacrimal. I lost the image. The lacrimal apparatus produces and drains tears. The lacrimal glands is located to the supralateral part of the orbit and produce the aqueous components of the tears. Tears spread across the eye and drain immediately to the lacrimal puncta, lacrimal caniculi, lacrimal sac, and nasolacrimal duct into the nasal cavity. This explains why we often have a runny nose when we cry. Common diseases of this system include dry eye syndrome and dactylocystitis. Dactylocystitis is the infection of the lacrimal sac, usually due to the obstruction of the nasolacrimal duct. Some common eye pathogens include conjunctivitis, cataracts, glaucoma, retinal vascular occlusion, and orbital cellulitis. The conjunctivitis is inflammation, as the conjunctiva may be viral, bacterial, or allergic. Cataracts are opacities of the lens that cause progressive visual loss. Glaucoma is usually associated with increasing intraocular pressure and can damage the optic nerve. The orbital cellulitis is an infection behind the orbital septum and is an emergency because it can spread to the brain of the cavernous sinus. To summarize the eyes and is surrounding from a highly organized anatomical region. The bony orbit protects the eye, the structural muscles control the movement, cranial nerves 2, 3, 4, 5, 6, and 7 are clinically relevant And the ophthalmic vessels provide the blood supply and venous drainage. Understanding this anatomy is essential because many lesions can be localized and clinically based off the eye movement, pupil response, eyelid position, vision, and sensory findings. In conclusion, the eye is not an isolated organ. It depends on the orbit, muscles, nerves, blood vessels, eyelids, and lacrimal system to the function properly. A good study of his anatomy help us to identify common diseases such as glaucoma, orbital fractures, nail palsies, infections, and lacrimal disorders, respectively. Thank you for watching. I see you the next day.